Family Feud. I'll be your host today, Jayla Wall. Let's play the feud. And let's meet the families. To my left, who do we have here today?
I'm Elena.
I'm Megan.
And I'm Brittany. And we are the trophoblasts. We provide the outer layer of the blastocyst,
providing nutrients to the embryo,
and eventually turn into the placenta.
Woo! On the other side we have
Haley,
Yadira,
and Jasmine, and we're Team Blastocyst.
the term blastocyst is the human embryo 5 to 6 days after fertilization.
we are the second stage of fertilization, right after the marula stage.
And we're the stage that an embryo must reach before implantation into the uterus.
we have Elena and we have Haley. Let's get ready to play round one. Alright, question number 1. We surveyed 100 nursing students when performing a neurovascular assessment to check for proper circulation and healing in a child with a cast. What should the nurse watch out for? Elena?
Pain.
Hooray! Haley?
Paralysis?
Elena, you want to pass or play?
We gotta play.
Okay, let's play. Alright, Megan, we surveyed 100 nursing students. What should the nurse watch out for?
pulselessness.
Good answer. Good answer.
Alright, Brittany, we surveyed 100 nursing students. What should the nurse watch out for?
I'm gonna have to go with pallor.
Okay?
Good answer.
We're down to the last one. No strikes. So, surveyed 100 nurses. What should the nurse watch out for?
I know there's gonna be some numbness and tingling. I'm gonna go with paresthesia.
Alright! Woo! Congratulations, y'all won this round. Alright, give me Megan, give me Yadira. Alright, this time we surveyed 100 community health nurses. A nurse is educating at the annual Community Women's Health Fair. What are the most common sexually transmitted infections that the group should be aware of?
I know it.
Syphilis.
Alright, syphilis. Megan?
I'm gonna go with HIV.
HIV. Yadira, you want to pass or play?
We're gonna play.
Okay. All right, Jasmine. We surveyed 100 community health nurses. What's the most common STI?
Jayla, I think I'm gonna go with gonorrhea.
All right, gonorrhea.
Woo! Yes!
All right, Haley. We surveyed 100 community health nurses. What's the most common STI?
Chlamydia.
Chlamydia.
Oh, good answer. Good job. Yeah.
What's the most common STI?
I'm gonna have to go with herpes.
Herpes. All right.
Good answer, girl. Good answer.
Ready?
Good answer, Yadira. My friend out there, Tommy, he has herpes. Hey, Tommy. How you doing?
Tommy.
You doing good?
Hey,
Good.
Tommy.
All right. I know it can't be cured, but you know it can be treated, and he's currently taking a cyclovir. Last answer. No strikes. So, what would you say is the most common STI?
I don't know. I think I'm just gonna go with yeast infection. Haley? Ah! Sorry, y'all.
So we got one strike, one answer left.
Okay, it's okay.
What do you think is the most common STI?
I'm gonna go with HPV.
HPV.
Good answer. Good answer.
All right, and make sure to get your Gardasil shots. They prevent HPV. Give me Brittany. Give me Jasmine. All right, what are the clinical manifestations of Hirschsprung's disease? Brittany.
Stinky poop.
Stinky poop. All right, Jasmine.
Abdominal distension.
Abdominal distension. You gonna pass or play?
We're gonna play.
Okay. All right, Haley. What's a clinical manifestation of Hirschsprung's disease?
Hemorrhoids?
Hemorrhoids. All right, Yadira, y'all got one strike on the board. What's a clinical manifestation of Hirschsprung's disease?
Let's go with inadequate weight gain.
Ooh, good answer.
Inadequate
Great.
weight gain. All right, Jasmine. So you got one strike on the board, 4 answers left. What's a clinical manifestation of Hirschsprung's disease?
I'm gonna have to go with COPD.
Okay. All right. right, Haley. What would you say is a clinical manifestation of Hirschsprung's disease?
Well, since you do already have abdominal distension, I'm going to say chronic constipation.
Okay.
Just stick with it.
Good answer, Haley.
Constipation. All right, Yadira. Well, you got 2 strikes on the board, 3 answers left, giving the Trophoblast team a chance to steal. You don't get this one right. All right. So, what's a clinical manifestation of Hirschsprung's disease?
Hirschsprung's. Hirschsprung's.
Hey, calm down. I don't have your
All right. Sorry, Team Blastocysts. We're gonna have to pass it over to Trophoblast for the steal. All right, Elena. Y'all have a chance to steal this question from another team. So, what is a clinical manifestation of Hirschsprung's disease?
We're gonna go with like this greenish, yellowish, frothy emesis.
Okay. All right.
Sir.
I'll say mama this. Congratulations! Y'all won. All right. Number 7.
That's so loud.
Palpable
Fecal
fecal
mass.
mass.
Number 1.
Failure to pass meconium in 24 to 48 hours.
Next up, I'm playing fast money. All right, we got a minute on the board to answer these 5 questions. So timer will start after I read the first question. You ready?
Mm-hmm.
All right, let's go. What are the top types of anemia in children?
Iron deficiency.
Name a symptom experienced in menopause.
Hot flashes.
Name a sign of respiratory distress in infants.
Retractions.
What are the functions of amniotic fluid in pregnancy?
Buffering.
What is a psychosocial issue in adolescents aged 13 to 18?
Peer pressure.
All right, Brittany, time to review your answers. Number 1, iron deficiency. You got 36 points. Number 2, hot flashes. You got 40 points. Number 3, retractions. You got 28 points. Number 4, buffering, shock absorber. You got 34 points.
All right.
All right. Number 5, peer pressure. Sorry. All right, let's bring out Elena. All right, Elena, your partner Brittany got you 138 points. Got a minute on the board. Any repeated answers, you will hear the sound, and that means to say another answer, okay?
Okay.
All right, let's get started. What are the top types of anemia in children?
Pass.
Name a symptom experienced during menopause.
Hot flashes. Insomnia.
Name a sign of respiratory distress in infants.
Retraction.
Oh.
Blue lips.
What are the functions of amniotic fluid in pregnancy?
Cushioning. Floating around.
What is a psychosocial issue in adolescents aged 13 to 18?
DUI.
What are the top types of anemia in children? Oh.
Iron deficiency. Oh. Mesothelioma. I got it. I know I got it.
So you need 62 points to win. Let's see what you got.
I got it.
All right. So number 1, nothing. Number 1 answer was iron deficiency. Number 2, insomnia. The number 1 answer was hot flashes and night sweats. Number 3, blue lips. Nothing. The number 1 answer was head bobbing. Number 4, floating around. We gave that as movement. So the number 1 answer was shock absorber. And number 5, DUIs. The number 1 answer was stress. So y'all fell short by 30 points, but it's okay.
We
You
don't
still won.
We don't get the 5
10.
bonus points.
So we're gonna talk to the teacher about that. Hopefully.
I might fail the class.
I know. That's right. So, but y'all still win that $1,000. Congratulations, Team Trophoblast! Woo!
Hi, my name is Yadira. I'm going to be talking about Hirschsprung's. Hirschsprung's is a malformation in the large intestines of newborns, or it's congenital. It's due to a lack of nerve fibers. And it's first detected between the 24 and 48 hours of not passing stool.
Hi guys, my name is Megan. I'm going to be going over some of the immunizations your child should get before they start elementary school and why. Okay, first we have Hep B, which should be given a little after your child is born, which protects them from premature death and liver disease caused by the Hep B virus. Next we have DTaP, which protects them against 3 different diseases. You have your tetanus, your diphtheria, and whooping cough, which is also called pertussis. And then you have your IPV vaccine, which protects them against polio. And then you have your MMR vaccine, which protects them against measles, mumps, and the rubella virus. And we have your varicella vaccine, which of course protects your child against chickenpox.
Okay, so I'm going to talk about infertility treatments. We have in vitro fertilization, GIFT and ZIFT, which is gamete intrafallopian transfer and zygote intrafallopian transfer. So IVF, in vitro fertilization, is where in a lab setting they take the ovum and the sperm and they fertilize them in a petri dish and let them multiply and divide, and then they place that directly into the woman's uterus. Now, GIFT and ZIFT is kind of a play off of that. So GIFT is with gametes. So they essentially take the ovum and the sperm and then they place them into the woman's fallopian tubes, where they then hope that they will fertilize, travel down to the uterus, and implant. Now, ZIFT is the zygote intrafallopian transfer. That's where they take the ovum and the sperm and they combine them in the lab setting and then place the combined ovum sperm fertilized egg into the woman's fallopian tubes, where it will then travel down the fallopian tubes into the uterus with the idea of getting a successful implantation and then pregnancy. And those are just some of the treatments for infertility.
Hey, so I'm going to be talking about epiglottitis. It is a potential life-threatening disorder that is very rare in the United States, but it is when the tissue around your trachea becomes inflamed due to infection, and it can also block the air going into your lungs. So if you were presented with this patient, you typically would not put anything in their mouth, as that could lead to aspiration. Some symptoms that you'll see in patients like this is drooling, dysphagia, dysphonia, and distressed respiratory efforts. Treatments to help out are some antibiotics such as penicillin, or in more severe cases, there will be a trachea placed in to help with breathing efforts or a ventilator.
Okay, my name is Elena, and I'm going to be talking to you about sexually transmitted infections, which are STIs for short. They're basically infections that are passed through sexual contact. Some common STIs are chlamydia, gonorrhea, and syphilis, as well as HPV, herpes simplex virus, and HIV. Diseases aren't treated properly. There could be some long-term effects, such as male or female infertility problems. With syphilis, if it's not treated, it could probably or most likely lead to neurological problems. So the best way to prevent yourself from getting these diseases is education. And of course, the best way is to remain abstinent. If you can't remain abstinent, then you're going to want to make sure that you use some type of barrier protection between you and your partner, and that could be male or female condoms. Ensure that you teach your patients that monogamy is important, not to have that many sexual partners, because you don't know what someone has. When you do get a sexual partner, it's very important that the both of you get tested so that you know, so that you basically know your partner. If any one of you is positive, you need to ensure that you're treated. If you have chlamydia, gonorrhea, those are usually going to be treated with antibiotics, as well as syphilis. HSV, herpes simplex virus, and HPV is going to be treated with Gardasil, and that's to prevent it from progressing to cervical cancer, which is the biggest risk for HPV. Treatment can start as early as 9 years old. So you want to make sure that you get tested for those things. If a person has herpes simplex, you want to make sure that they're taking the antivirals in order to reduce the amount of breakouts that that person has, as well as making sure they use some type of barrier protection between themselves and their partner. And as far as HIV, you want to make sure that you're taking your HIV antivirals in order to prevent the disease from progressing to AIDS.
So for pregnancy complications, there's usually a common misconception of what's considered to be a miscarriage and an abortion. Usually a miscarriage is also considered an abortion, but people don't really assume that it is. So it's important to usually inform patients in terms of whenever you say abortion, that's not always what they mean. And it can also just be from something that's spontaneous, which usually is a miscarriage. So for two common ones, there is placental abruption, which is the partial or the total detachment of the placenta from the uterus. And it can have multiple symptoms, which is the sudden onset of abdominal pain. There is a lot of bleeding, tenderness, tight uterus, and the exact cause is usually unknown. So you would usually want to give emotional support and check for hemorrhaging. Just keep monitoring that in terms of keeping up with the fluid loss in the body, and if they go into shock, so you have to make sure that doesn't happen. The risk factors is previous miscarriage, trauma, chronic hypertension, with exposures to drugs or chemicals, loss of amniotic fluid, infection, and smoking. That's a common cause for a lot of problems. Another pregnancy complication that's pretty, well, it's not completely common, but it can easily happen, is the threatened spontaneous abortion, which will happen in the first 20 weeks of the pregnancy, and it can lead to a miscarriage as well. The symptoms is cramping, bleeding, no product conception past, and there's no cervix dilation. And the exact cause for this one is unknown as well. The risk factor, is infection, trauma, being older than 35 years old, and exposure to certain medicines or chemicals, and those are also the risk factors for the other complications as well. But yeah, you want to make sure for interventions, you just want to make sure to give emotional support, because obviously it's a big loss and that can really mess with the psychological state of mind for the patient. So you want to make sure to do that and just make sure no big complications happen in terms of losing too much blood or fluid.
Okay, I'm going to talk about neurovascular checks and hemophilia A. So it's important with neurovascular checks to check for circulation and perfusion, and make sure you check the 5 P's, which is pain, pulselessness, paralysis, paresthesia, and pallor. It's important to check these to make sure that your patient is not developing compartment syndrome, which is a medical emergency. Hemophilia A is when the body does not produce any factor VIII and the blood does not clot normally. So it is important for prevention for these patients is to administer their medication early if you know that they're going to be going out, playing on the playground or out with their friends at anywhere that they could potentially get hurt. And also the treatment would be the factor VIII medication, and ice for swelling joints, and also pain management is important with acetaminophen and ibuprofen.
Common symptoms of cancer treatment. We're going to have alopecia, we're going to have nausea and vomiting, infection due to neutropenia, hemorrhage and anemia, secondary malignancies, pain, and mucosal ulceration.